Let's talk about a topic every medical assistant thinks about, but rarely gets honest guidance on: salary. Because if you've ever felt underpaid, undervalued, or unsure of what you should be earning, you are not alone. Point. And you're not imagining it. Medical assistants across the country report some of the lowest starting wages in healthcare, even though the job requires intense multitasking, clinical skill, and emotional labor. So today, we're breaking down what MA pay really looks like and how you can negotiate with confidence. Here's why this matters. Medical assisting is projected to grow around 14% over the next decade, which is much faster than average. More demand means more leverage for you. And national data shows that certified medical assistants earn, on average, 5 to 12% more than non-certified MAs. But most MAs don't realize they have room to negotiate, or they're unsure how to start the conversation. Point. So let's break this into something clear and usable. First, understand the salary landscape in your area. The national average pay for medical assistants sits around the mid-$17 to low $20 range per hour, depending on state, experience, certification, and specialty. But here's the nuance. Urgent care, orthopedics, dermatology, and cardiology often pay higher because they rely more heavily on skilled clinical tasks. Meanwhile, primary care and pediatrics tend to pay on the lower end. If you're in a state like Washington, California, or Massachusetts, wages may be higher due to cost of living. In states like Alabama or Mississippi, averages run lower. The important thing is knowing your local number before you walk into a negotiation. Most MAs skip this step, but it's the foundation of advocating for yourself. Second, leverage your certification and skills. They're not just bonuses. Certified MAs consistently earn more because certifications prove competency. But what really moves your pay forward is demonstrating value. If you can say, "I'm trained in EKG, phlebotomy, injections, sterile technique, prior authorizations, and rooming efficiency," you're no longer asking for a raise. You're proving why you deserve one. And here's a stat that might surprise you. Clinics that have highly skilled MAs can turn rooms faster, which increases provider productivity. Productivity equals revenue. That means your skills directly impact the bottom line, even if no one ever told you that. Third, when negotiating, focus on impact, not emotion. It's normal to feel nervous. Around 55% of healthcare workers say they avoid negotiation because they don't want to seem difficult. But negotiation isn't conflict, it's communication. Try this framework. Start with gratitude. "I appreciate the opportunities I've had here." Present your value. "In the past year, I've taken on X responsibilities and gained X skills." State your goal clearly. "Based on local salary data and my contribution, I'm seeking an adjustment to around $30. Direct, respectful, confident. And remember, if a clinic can't match your goal, you can ask for benefits instead. Education reimbursement, certification fees covered, a raise after your next evaluation, or cross-training that moves you toward higher-paying roles. So save this if you're thinking about your future. And remember, advocating for fair pay isn't selfish. It's part of building the career you deserve, and you're worth that conversation every time.